Welcome to our live outcome case study. Is so you understand a little bit better about who we are, what we do, but also we have a bigger goal to help you better understand how to score an outcome or what your score is or what you should expect if you get a specific type of treatment for your back problem or your sciatica. So we talk a lot about outcomes, and outcome is really what happens as a result of your treatment. Did you get better? How much better? Can you give it a score? We'll score it. So the lesson for today, case study number 30, is a 56-year-old male, back pain and leg pain, which is sciatica. All the patients we're going to talk about for the month of December are patients that had sciatica. He had had back pain and leg pain for 5.3 years. So he'd been suffering with this problem for a long time. And he had tried other treatments and he didn't respond very well. So before he came to see us, he saw 3 different doctors for his back problem. Had an MRI, which is very common, and he tried physical therapy. He tried chiropractic, and he tried non-steroidal anti-inflammatories. This is a fairly traditional course of care when you've had a back problem that you've been suffering with for an extended period of time, which is consistent with his condition. So the statement would be that as he went through these programs and he didn't respond to therapy, which is typically the patients that come to see us have tried other therapies and not responded, the outcome for these 3 therapies would not be very good. So you'd say, what was the outcome? Well, the outcome's bad. Could you score it? Depends if you got any better. But we know when he came in, he was in a lot of pain. So he came in to see us, and we have a process. We have a 9-step solution for sciatica. And this 9 steps is about identifying what's causing your sciatica. We did a video on Friday about the 5 causes of sciatica, but when you come into our clinic, our goal is to identify the source of the problem. We have a very specific type of MRI that we perform. It's a proprietary procedure. And with the MRI, we're trying to find what is pinching the nerve. Sciatica is a pinching of the nerve as the nerves exit from the spine. So when we do our MRI, we're looking in the space where the nerve comes out of the spine. And we're looking to see what's happening inside that space. So in his particular case, he had a herniated disc. And the herniated disc is where the disc material pushes into the spinal canal and pinches the spinal nerve. He had a degenerated disc, and a degenerated disc is where the disc breaks down and you start to get some narrowing of the opening here where the nerve comes out, causing a little pinching of the nerve. Okay? He also had a bulging disc, which is a smaller version of a herniated disc. And he had stenosis. And stenosis is a narrowing typically of the spinal canal in this area right here. So we know he had a herniated disc, had a bulging disc, had the degenerated disc that we talked about, and also had the stenosis. Now, there are typically 5 causes to sciatica. He had 4 of them. So he had a lot going on. Had a pretty advanced breakdown. Disc degeneration with the bulging, the herniation, the stenosis is going to cause the sciatica. So he had some pretty severe problems going on inside his spine. He started our therapy. When he started our therapy, his back pain and his sciatica was an 8. Now we score back pain and sciatica from 0 to 10. 0 means you're happy and you have no pain, and 10 means you're very sad, because it hurts. It's hard to deal with. So we score it. His particular case, he had an 8. He had pretty severe back pain. Falls under the category of more severe. He had an Oswestry disability index of a 40. Now, When we score the Oswestry Disability Index, we score it on a score of 0 to 100. The Oswestry Disability Index is a questionnaire that we have you fill out that helps us identify the amount of disability you have as a result of your problem. Disability being, it's hard for me to walk, it's hard for me to sit, it's hard to get out of bed, it's hard for me to sleep, it's hard for me to work. So we have you score all these things, and the higher your score, the more severe the problem is. So in his case, he had a 40. And we know that 40 is kind of moderate to severe, right in this area right here. The longer you have sciatica, and the more treatments you've tried and you've not gotten better, and you have a herniated disc and or stenosis, typically the goal would be both stenosis and the herniated disc and the degenerated disc. The goal is surgery. Now, he didn't want surgery. He came to see us. A typical patient with an Oswestry at 40 or above for an extended period of time ends up in surgery. Came to see us, went through our program, started at 8, Oswestry at 40. At the end of 36 treatments is what he had. At the end of the program, his back pain and his sciatica was a 0. Completely went away. Okay? Now he's back here. He's feeling pretty good. His Oswestry also went to 0. So the question is, what's the outcome? Well, the outcome is the change in the pain and the change in the disability. How much better do you feel? What is the change in your Oswestry? So in his case, his pain went from an 8 down to a 0, and his Oswestry went from a 40 down to a 0. So the score would be 8, because his pain improved by 8. His Oswestry score would be a 40. His outcome was his Oswestry changed by 40. So when we talk about outcome, we talk about pain and Oswestry. How much is the pain affecting your life? And what is the disability as a result? So when you go through a therapy, what you need to know is what is the outcome at the end of that therapy. We have 550 case studies just like this of these patients. Okay? In his particular case, he didn't need surgery. We saved her from surgery, end of care, he's better. So the outcome is 8 and the Oswestry is 40. Okay? That's how we score it. It's important for you to know what the score is because doctors do not have to publish their outcomes. So when you get a procedure, they're not obligated to publish their outcome. Our goal is transparency so you know what the outcomes are. Case study number 30. Tomorrow, we're going to talk about more case studies, and we're going to talk more about outcomes, and we're going to talk a little bit more about herniated discs this week. Somebody said, what's the difference between a herniated disc and a bulging disc? So to define that for you, we're going to show you what a herniated disc is, and then we'll show you what the bulging disc is, and we'll compare the two so you understand it. But our goal is to solve your problem, and part of that is you understanding the outcomes. That's it for today. Have a good day, and we'll talk to you tomorrow. Thank you very much. Drive safe.